Both PTSD and TBI are invisible injuries, and it may be confusing to discern between the two or to understand some of the overlapping symptoms. Here's an overview of both conditions. Post-traumatic stress disorder, or PTSD, is the body and mind's response to a traumatic event and is more commonly seen in veterans and first responders. With both body and mind involved, this is both a physical and neuroendocrine or hormonal response to perceived danger, and downrange was very helpful for survival. Symptoms may include avoidance, isolation, emotional numbness, flashbacks during the day, and night terrors or insomnia. The veteran may relive the trauma, and this can strain the entire household. There may also be a startle response and hypervigilance or unusual aggression. Treatments vary depending on severity of the symptoms and may include medication, specific counseling therapies, or in combination with stress-relieving treatments. Traumatic brain injury, or TBI, is actual physical or biological damage to the brain, and treatment may be complex depending on the severity and the part of the brain injured. Symptoms may include headaches, fatigue, blurred vision, dizziness, and balance issues, restlessness, and also agitation. Most often, the family notices TBI when memory and concentration issues complicate the relationship and household. While driving, suddenly he or she doesn't remember how to get home, may have anger outbursts with unfiltered speech, or have personality changes, leaving the veteran wondering what is wrong with everyone around them, and the family walking carefully on eggshells. Recognize that TBI may not show symptoms immediately, but if unusual, agitated, or confused behavior continues, please seek an evaluation. PTSD and TBI may occur together and share certain symptoms. Mood changes, changes in focus, and concentration are common in both. Both share sleep difficulties with either too much or too little sleep, exhausting the vet and the family. Recognizing that something is different, coupled with relationship, discussions, and changes, lead many families to seek treatment only after the quality of life has deteriorated at home. With brain injury, neurological and cognition testing will determine the treatment path, and new treatments are showing promise. Often the most difficult step is for the caregiver to convince the vet that there is something wrong, organically wrong. It can be a relief after the fact, but challenging to initially seek care. New treatment options, such as hyperbaric oxygen therapy, or HBOT, can help both TBI and PTSD, as can certain medications and alternative therapies, such as mindfulness, EFT, yoga, golf or sports therapy, and service animals, depending on the severity of the symptoms. Be diligent and persistent when you feel something is off. Keep a journal or list of behaviors and other changes, and know that help and improvement exist with understanding and professional help.